Welcome back to the Women's Vibrancy Code podcast. I'm looking forward to today. Let's talk about fluoride and mercury and oral microbiome and autoimmune conditions, all through the lens of our oral and health and our dentition. I have with me Dr. Michelle Jorgensen, and she is an internationally recognized author, speaker, and pioneer in holistic dentistry. And after her own personal experience of mercury exposure in her dental practice, she became ill. And then she's like, wait a minute, there's got to be better solutions. So she became board certified holistic health practitioner. She's passionate about teaching and mentoring. She's a mother, a grandmother, and she enjoys gardening, cooking, and embracing nature's gifts. She comes to us from Salt Lake City. You'll see if you follow her on social media, she's got quite a large following. And it sounds to me like, Michelle, you're really passionate about educating people.
Definitely. I love to share. So thank you for having me here so I can.
Yeah, I'm happy to have you. I'm curious, what brought you into dentistry in the first place?
So my dad's a dentist, and I just grew up thinking that I wanted to do something inside of dentistry or medicine. At the time, dentistry had a lot of spit involved, and so I didn't think dentistry was really the way I wanted to go. They weren't wearing gloves, none of that. All right, I can do that, I think. So, yep, they've always just been around dentistry. 3 of my younger brothers also followed in that same path, and 2 are orthodontists, one's an oral surgeon. So that's just kind of what we do in our family.
Okay, so we become dentists. You know, it's interesting. I was a midwife. I'm still a midwife, but I attended births for 17 years.
Wow.
And I can't tell you how many women said that they are more afraid of going to the dentist than they are giving birth.
Yep. When I first started my very first practice, that was really the tenet that we went on, as we said, we want to change everything in dentistry that people don't like because of that exact thing. People would say, I'd rather have a baby than go to the dentist. And I'm like, I've had a baby. You can't tell me that what I do is worse than that. And so that was really our first mission, was to create a dental experience unlike any other that would make all of those bad things about the dentist, things you don't look forward to, don't like, how we could actually change those and make those into a positive. So that's really how my practice started.
So can you just tell us a little bit about your journey of mercury poisoning? What were the signs? What were the symptoms? How long did it take? Just educate us a little bit and share your story.
Yeah. So like I said, the practice was growing. We were doing a lot of great things, taking good care of people. And, the word was getting out and a lot of people were coming. I was really focused on cosmetic dentistry. I love helping to make people, feel better about their smile and better about themselves. And I just thought I would do that forever. My dad is still practicing in his mid-70s. I just thought that that's what I would do for the rest of my career. And I was loving it. But I wasn't well, and my symptoms really started to escalate. I had gut issues. And, at first when you have gut problems, you just think, oh, well, everybody does. It's just because we're not eating enough good foods. We're not eating clean, whatever those words are. So we changed all of our diet and threw away all of our food, and the gut problems didn't go away entirely. I got to the point where I couldn't even drink water without pain sometimes. But then the brain issues started happening, and I've always had a good memory, but I couldn't complete sentences. I couldn't remember a patient's name from room to room. So it was very noticeably different. But the big one that was really life and career changing was numbness. I had just severe, painful numbness in my hands, all the way down my arms. I couldn't sleep at night. I couldn't blow dry my hair. I couldn't put on mascara. I couldn't hold a pen, and I couldn't even hold my dental instruments anymore. I had lost dexterity. I couldn't grip. And that was the one that really, I couldn't keep going. And so I put my practice for sale, and we didn't know what we were going to do. I was in my mid-30s, 4 young kids. My husband worked for the practice too. So this was our entire livelihood. And at that real low point of what are we going to do, I was talking to another dentist about perhaps teaching nutrition in my dental practice or something of that variety. I thought, well, I could do that without holding instruments. And he said, your symptoms sound a lot like mine. Have you ever looked into mercury poisoning as a problem? And that was the first time anyone had ever said those words. And I said, well, I don't have any fillings, and, they're completely safe. And he said, it's not the fillings you have. It's the ones you've been drilling out, because I was a cosmetic dentist. So I was taking out all these fillings. And he said, I think it's probably worth you getting tested. Don't you think? You've been tested for every other thing and nobody's given you any answer. So don't you think it's worth it? So I got tested, and that's what it was. Mercury toxicity off the charts.
And how did you get tested? Did you go to your primary care provider? Did they give any pushback? Did you go to a functional medicine, a naturopath?
It was an MD that's local, but she's always had a more holistic bent to her practice, and I knew about her. So I went to her office, and yep, it's what's called a provocation test. So mercury goes and hides in the body, hides in the brain and the kidneys and other places. So you can't just do a regular old blood test or urine test and find it because it's hiding out and it's not easily testable. So you have to do something called a provocation test where you take something and it pulls the mercury out, or chelates is the word that is used. It chelates and pulls the mercury out of the tissues. So then it's available. And the kidneys are actually where most of the mercury from fillings goes. So it's going to show up in the urine. So I had to do a 24-hour urine test where you collect all your urine over 24 hours after this pulling process that I did for about a day as well. So thankfully, that doctor knew what she was doing. And when we found this result, she said, well, you can't get better if you keep putting it in. You can't keep putting it in and taking, and trying to get it out at the same time. So you've got to do something different if you're going to stay in your career. So I found there was an organization that did what they called safe mercury removal. So the organization is called the IAOMT. You can look it up, and there's a great directory on there, IAOMT.org, a great directory for dentists who do this. And I found that they had these protocols. I'd never heard of them before, but they walked me through everything I needed to do to remove fillings, but do it in a way that I wasn't going to get mercury. My patient wasn't going to get a mercury. My assistant, receptionist, nobody was going to get more mercury in their body because of it. So I started doing all of this, and patients were very much wondering. It's kind of like you and glasses, but it was even more so. They were like, what is going on here? Why are you wearing this crazy mercury mask? Why is this like giant vacuum at my chin now? Why are you covering my skin and my body? Like, what's going on?
Yep.
So I would explain my journey and why I was doing it, that this was for my own purposes, but I was also learning it was also good for them. And they would start directing me to other people. They would say, oh, my sister. Yeah, I think my sister's going to be really interested in that. She's been talking about that. Or, my doctor's probably going to really want to know about you. So all of a sudden, people would ask me other questions. Like they would say, what do you really know about fluoride? Like, I know you dentists, you all push it, but like, what do you really know? Or what about root canals? I just saw this like crazy video and, what's really going on with root canals? So I didn't have answers to any of these questions. I didn't know about any of this. I was asked by others and I had to then go find the answers. I'm a real, I don't like not having the answers to things. So I had to go find the answers. And when I found those answers, whoa. Honestly, dentists are trained that we just fill holes. You get a cavity, we fill it up and we tell you to floss a little bit more. That's all we do. But I realized I really have learned that there is an enormous influence that dental health has on the rest of you. Not only that, but I can look in your mouth and I can determine a lot about how healthy you are and what's going on and so many things I can find out. So now we have a multi-specialty practice that we have a full campus of health-based dentists, and we see people from all over the world. And we just basically help get to the bottom of chronic disease and issues and energy, low energy levels and brain fog and the things that people are struggling with. And we find answers in the mouth. So it's
so amazing. Yeah. Especially once again, I come back to all the years that I practiced as a midwife. The research was compelling even back in 2006, how much we could tie a woman's dentition to the quality of her placenta, the quality of the baby. So I'm just so grateful. Okay, you mentioned fluoride. You also mentioned root canals. Let's go there. Do you happen to know Dr. Doi? He's on the Big Island in Hawaii.
I don't.
Okay, when I lived there and worked there for 8 years, and he was my dentist, and I'm so grateful because he was the one saying, if you're going to be part of this practice, you have to read this book about fluoride, and no, you may not do it. And
nice.
Okay, so let's talk about fluoride.
Fluoride's one of those sacred cows inside of dentistry, but it started for a good reason. In the 1940s, they found that people who had higher levels of fluoride naturally in their water, so this was well water, people were drinking out of wells, people who had higher levels of fluoride naturally had stronger, more cavity-resistant teeth. They were also kind of splotchy, like brown and white spots on their teeth, but they didn't get cavities. So they said, this is the answer, because they were just really so frustrated. Why is tooth decay such a big deal? And it is the most common communicable disease in the world. Like, it's the most common disease people have, and people think, disease? Yeah, cavity is actually bacteria. It's like it's an infection. So it's the most common infection there is in the world. So they really wanted to stop it. They said, fluoride is the answer. So started putting it in water. In the 1940s, started adding into water, saying, okay, great. If it was good in this people's water, then it must be good in everybody's water. Started adding it to toothpaste, to mouthwash, I mean, to everything. And the idea is awesome, right? Let's just create cavity-resistant teeth. So the first question I always ask is, did it work? Has anyone gotten a cavity since 1940?
Yes.
Probably, right? So it didn't achieve the goal. It did not achieve the let's eradicate tooth decay. Let's get rid of it completely. It didn't do it. So there must be something else that causes cavities besides just, a deficiency of fluoride, that is a true statement. We won't go there. But so fluoride didn't eradicate tooth decay. Did it make teeth stronger? Perhaps. Did it slow down cavities? Maybe a little. But the problem is it doesn't just stay put. Anything that we put in our body is going to affect every single cell in our body. This is what's called a side effect. And some of the side effects are like, oh, those darn side effects. Well, anything you put in you is going to affect everything in you. So there's no way to avoid a side effect. Well, some of the side effects of fluoride are, number one, it decreases thyroid efficiency. This is a huge one. And this is the crazy thing. As I started studying this in the 70s, they were using fluoride as a treatment for hyperthyroidism. Anybody that have thyroid issues or energy issues or fatigue issue, anything like that? Oh my gosh. So it decreases thyroid function. It changes the density and the structure of bones because fluoride, it incorporates into the tooth structure, into the enamel of your tooth and creates something called fluorapatite. It should be hydroxyapatite, which is a calcium crystal. That's exactly what your bones are made of too. So when you change your teeth with fluoride, you change your bones with fluoride. It changes the density and actual bone structure. So there's finding big time issues with bone strength and bone brittleness and things in areas that have high fluoride. Another one that's huge, literally a new brand new research study just came out in January, showed that when moms, this is one you should be targeting, and if you're working as a midwife for years, when moms had fluoride in their systems, babies, they can equate it equally down, decrease in IQ in the babies where moms had fluoride in their systems. I mean, it was 1-to-1. Fluoride up, IQ down, straight across the board. So we know it affects neurodevelopment in children. We know it affects the brain and the function of it in adults as well. So I can tell you all this now. And, it used to be I couldn't tell you this, but I can now. And so I always say, okay, fluoride, the idea of it's awesome. Let's prevent tooth decay. Did it work? No. Fluoride also affects your thyroid, your bones, your brain. Is it worth it for something that didn't stop cavities?
So then instead, do you just suggest using hydroxyapatite? Like, I love the designs for health. Okay. Yep.
Absolutely. Yep. So I have a whole line actually of hydroxyapatite products because of that exact reason. I said cavities are not a deficiency of fluoride. They're a deficiency of minerals.
It's amazing the pressure, even from the dentist here. When my children go in, we go for our cleaning, they put so much pressure on us. And I say, no, you can do the tooth cleaning, but I want the fluoride-free option. And I've suggested hydroxyapatite. I've said, here's the toothpaste that I'm using. It's really alarming how the message has not yet trickled down. And so I'm grateful that you're up there beating the drum at the top of the mountain. And I hope that everyone that is listening to this, if you have a friend that's a dentist, if you have a friend that goes to the dentist, share this episode, right? And we can stop using the fancy color-infused toothpaste that are also fluoride infused. There's so many other options.
Yep. And the thing is, like I said, the fluoride doesn't strengthen teeth, sure, but it does a lot of other things. And it's not the only thing that leads to tooth decay. Tooth decay is a deficiency of minerals. Well, they can be pulled out by the food we eat, the things we drink. It can be pulled out by your body if, like during pregnancy, during the times when children are growing, during teenage years, the body needs more minerals than it's getting. Guess what it does? It goes and finds them in the teeth. So I will see people with 5, 6 cavities. They had 0 last time we saw them. And I say, what happened? So I just got a growth spurt. He just grew 2 inches. Oh, he didn't have enough minerals to support both his teeth and his bone growth. Okay, we got to super supplement the minerals. So that's why I talk about minerals on the outside, which is the tooth powder, toothpaste, all hydroxyapatite, mouthwash. I have a mouthwash with hydroxyapatite, minerals on the outside, but also minerals on the inside. Because your body will mine the minerals from the teeth if it doesn't have enough. So I have what's called tooth and bone formula. You have to pair it with vitamin D3, vitamin K2 to get it into the cells properly. Anytime we got a pregnant mama, nursing mama, growing teenagers, absolutely have to have minerals on the outside, Minerals on the inside, otherwise the teeth will suffer.
I love this. And I'm not working, well, I have some clients that are still pregnant, but a lot of the women that listen to this podcast are in this transition of perimenopause and menopause. And just to say hello, how many of those women end up with a thyroid condition? Most often Hashimoto's or hypothyroidism and adrenal fatigue. So we go back to the need to remineralize, add on the way produce is grown these days. It is I could go on, and I'm sure you can too. You want to speak a little bit just to, for those of you listening and you're like, but I eat so well and I eat a lot of produce. How are things grown today? And how do we just have access to natural mineralization that has to, really, we're at a point where it almost has to be subsidized at this point.
Yeah, so it's interesting. I'm a huge gardener. Actually, I'm looking out over my huge big homestead right here. And we grow all of our own food from pretty much like March through October. But I know that I am like people just don't have access to that. So we all have access to what comes in the grocery store. The problem is the way that commercial agriculture is grown. Instead of in the, 100 years ago, what would happen is they would feed the soil. They would use compost. So everything that grew last year, they would make compost out of it. They would put it back on the soil. So now that squash that, was left over from last year, the minerals in it would go back into the soil. Now, when the seed sprouts and grows, it pulls the mineral from the soil and fills the new squash with those minerals. But what happens today is they want to grow food faster than that. So instead of feeding the soil, they figured out that 3 minerals, nitrogen, potassium, phosphorus, it's called NKP. Those 3 minerals will grow the green part of the plant rapidly. So you're going to get a faster, bigger plant with those 3 minerals. The problem is our body needs a lot more than NKP. So now we have the plants grown with just this fertilizer that will grow the plant, will make it look amazing, but the soil is completely deficient. So we've got the squash. The squash today is not the squash of 100 years ago, because 100 years ago it was grown pulling nutrients from the soil. Today it was grown by artificial fertilizer sprayed on the leaves. So now the food is not the same that we're eating today. In fact, my new book talks all about this and how the food, it just isn't the same today. So I don't love supplements. I am not a huge pusher of supplements and pills, but in some situations we have to do it because we're just not getting enough of the food. Or another option is go meet your farmer. Go to farmers markets. I love online classifieds, like literally Facebook Marketplace. You're going to find people who have a backyard homestead like I do, who grow way more food. Like literally, I had enough lettuce this spring. I probably could have fed a family of 100. It was so much lettuce. And so what do? I go and I share it on Facebook Marketplace. This lettuce that you cannot find in the grocery store because it is full of nutrients. Yeah. So that is what I encourage people to do, is you really need to make sure you're getting those nutrients. Now, the interesting thing is, as a society in general, we're seeing the effect of this, because the first bone affected by malnutrition is the top jaw. I know this for a fact. I've studied this extensively, but we adopted a little boy at 2.5 who had been really malnourished. His top jaw was so small that all of his top teeth fit inside of his bottom teeth. If you look at your teeth, you're going to see that it should be the opposite. The top teeth are on the outside, bottom teeth are on the inside. His teeth were lined up like airplanes on a runway. Like they were so tight, he couldn't. That was one of the reasons his birth mother chose us as his family, as she said, he needs some serious help. And we know that you as a dentist are going to be able to help him. So how many people do you know now that have crooked teeth, had to have braces, or had to have their wisdom teeth out?
The majority.
Every person on the planet, pretty much, right? Why? Were we not born to fit all of these teeth in our mouths? Mm-hmm. All of our top jaws are malnourished. Basically, we're all malnourished. We're not getting the nutrients and the minerals we need to grow that bone. Yeah. All our top jaws grow too small, means our bottom jaws grow too small, means now all of a sudden we all have crooked teeth. We don't have room for wisdom teeth. We're not sleeping well because there's no room in our mouth for our tongue to fit anymore. So everybody has poor sleep. I mean, that's talking to all of your, perimenopause, all these people. That is all what that's about. So nutrition shows up in a lot of different ways. And that is one of the times of life. That's exactly where I'm living right now, is that perimenopause/menopause stage. That's another time that we have a huge draw and a huge fluctuation in hormones. Also needs a lot of minerals. So you have to supplement the minerals and the vitamins D3 and K2 in order to have healthy bones and healthy teeth as you transition through these times.
So good. And for those of you listening, you might want to go back and listen to the interview I did with Dr. Tanner. And that was specifically really honing in on airway, going back to dentistry, so good. I love that you mentioned local farmers markets, CSAs, and
Yep.
also the beauty of getting produce that had the opportunity to be ripened on the vine because the stuff we get at the grocery. Okay. What about oral microbiome? We're hearing so much about gut microbiome, which I'm sure you have a lot to say about. And also, for those of you that are listening, all these references that she's making to her books and products, we'll make sure all the links are in the show notes. So don't worry, just keep listening. It will all be there. Just look in the show notes. You can get all the stuff. Can you speak a little bit around, what are your thoughts on microbiome and oral microbiome?
So the first thing that I always like people to understand is the mouth is the gut. It's the starting part of digestion, but we don't often think about that. It's the where, you put food in your mouth, even sometimes before you put food in your mouth, right? Saliva starts to flow. What is that? Saliva has something called amylase in it, which is an enzyme. As soon as the food hits that enzyme, it starts to digest it. So the mouth is the starting point of the digestive tract. Gut is an interesting thing. I like to think of it as different rooms in a house. So there's a room up here that's the mouth. There's a room that's the stomach. There's a room that's the small intestine, another room that's the large intestine, and it kind of, we move through these rooms. Each of those rooms has its own set of beneficial bacteria, its own biome. They have to be there. Those bacteria do so much work for us. They defend us. They help to digest food. They do a lot of different things. We have to have them. They're just part of us. But they can get out of whack. And there's some things that can really make it get out of whack. So we should have different bugs in the mouth than we have in the stomach. And think about it. Like the bugs in the mouth are there to defend us. Most everything coming into the body comes in through the mouth, does it not? Our food, our water, our air, like everything comes in through the mouth. So we need bugs in here to be to be battling those bad bugs. Anything that comes in that food and water and air, we need them to be there. But then when you get to the stomach, we need different bugs. We need bugs there that are going to live in a high acid environment. We want a lot of acid there in the gut because that's where the food needs to get broken apart. Mm-hmm. So we need different bugs in different places. But we have lived in this world of antimicrobial everything, where we're killing every bug in sight. This is a real problem because if we don't have the good bugs, then our bodies don't work like they should. So one of the big offenders in dentistry is mouthwash. Traditional mouthwash is highly alcohol content. I mean, some of these are like 70% alcohol. Well, what does alcohol do? It kills bacteria. This is why when you go to the doctor, they use that alcohol swab on your arm. Why do they do that before they give you an injection or, whatever it is? Because it's going to kill the bugs on your skin, right? Alcohol is a disinfectant. Well, if you're rinsing with an alcohol mouth rinse, guess what you're doing to your mouth and stomach biome? Obliterating it. You are wiping it out. So now you're going to have yeast overgrowth. So now you're going to have candida. You're going to have all sorts of issues. You're going to have bloating. You're going to feel bloaty in your stomach. Nothing's digesting well. You're going to have acid reflux. All of this because you're killing off your good bugs. Yeah. So there's a couple of ways you can really encourage the good bugs to grow. One of them is really simple and it's been around for thousands of years. It's called oil pulling. And people may have heard about oil pulling. All you're going to do is take a blob of oil, like a tablespoon of, I prefer coconut oil because it doesn't taste really like anything. And you just swish it. You just swish it all around in your mouth for about 10 minutes. Spit it out in a Kleenex and throw it away. And what the heck are you doing? Well, the oil in that oil, the coconut oil attracts the outside of bugs. Like around every single bug is this fatty membrane. So it just sucks up to it and attracts it. So you're literally pulling all the bugs from everywhere. So now you might say, well, isn't that what you said not to do? I want you to do it if you have a biome issue, like if you have a real white tongue, if you have red or swollen gums, if your gums bleed when you brush or floss, any of those things, oil pulling could be a beneficial thing for you. So you're going to oil pull for 3 days or so, and then you're only going to do it about every third to fourth day because you want to balance, but not get rid of everything. Mm-hmm. That's one way to do it. Another way to do it is I have a gum health mouthwash that has a prebiotic in it. Mm-hmm. It selectively feeds the good bacteria and kills the bad bacteria, starves them out so they can't survive. So I recommend, this is the one I do because oil pulling, honestly, I don't have 10 minutes to walk around swishing a blob of oil in my mouth very easily. But that's really accessible to most everybody, so I always throw that option out there. But I love a prebiotic mouthwash if possible because we're going to just be able to encourage the good guys and starve out the bad guys and keep everything balanced.
So good. I love that you not only highlighted taking out the quote unquote bad stuff, but also how do we replace it with the good stuff? And for those listening, prebiotics help the good bacteria do a better job at what they're intended to do in any form, however you're ingesting prebiotics. So good. Okay. What about, when I think about health outside of oral health, most of us are familiar with this idea of Eastern medicine versus Western medicine. A more traditional approach versus a more holistic or alternative approach. Is there such a thing in dental care? And if so, how does someone go about finding the right practitioner if they're wanting a more holistic or Eastern or alternative approach, like the things that you're talking about? For the listeners that are all over the world, all over the North America, where do they start?
When I first started going down this path, I only knew to call myself holistic. That's the only word I knew. But holistic brings a lot of baggage with it. People think that you're crazy, and they think that you're not based on science, that you're just like, chanting and burning incense or, all the crazy things. And people come to my office and they're like, this is the most technologically advanced office I've ever been in my life. I'm like, yes, because I have to defend every single thing I do. A regular old dentist, you go in and say, well, why are you using fluoride? They say, because you're supposed to. Like, they're not going to quote research articles to you. But if you come into my office and I say, we're not using fluoride, they're going to say, show me your research articles, so that I have to show them. So I have to have science substantiate everything I do. So I actually started calling myself a health-based dentist. Because for me, it didn't bring along that stigma of crazy lady, and it still explains what I am. Regardless, you can find a dentist called a holistic, or biological is another word that sometimes is used. It's all the same thing. It's all focused on how does dentistry impact overall health. And honestly, research shows 60 to 80% of chronic disease is related to the mouth in some way.
Yep.
That's huge. So there's two places you're going to go look for this. One is my website, livingwellofdrmichelle.com. I have a directory on there, and it's free to you. For all of those who are listening, we get about 70,000 views on that per month of people looking, because that's my most common question. Where do I find a dentist just like you? So I went out and I personally selected dentists around the country to be on this directory. So you can go to this directory. Do they do everything I do? No, because no offices, honestly, are as big as ours. So sometimes, they do one or two things that we do, but they do them right. So go to that website, livingwellofdrmichelle.com. Now, we don't have somebody in every single municipality, in the country yet. We're working on it. But the other place you can go that has another list is that IAOMT site that I talked about. So IAOMT.org. Those dentists are largely going to be focused on safe mercury removal, removing mercury fillings safely. And I tell people all the time, if you have silver fillings in your mouth, they are 50% mercury. Just like I found out the hard way, they're 50% mercury. But if you don't have someone that will remove them safely, don't get them out, because that is going to be your biggest dose of mercury is during that removal appointment. So go find somebody on this list, find somebody who has following the SMART protocol. Make sure you're doing it right if you're going to have it removed. And that website, the IAOMT website, has a list of dentists who are thinking about that, have been trained in that way. That's where you're going to want to go. And, we commented at the beginning about, education, and that I'm passionate about that. What I've learned, any kind of medical education program, so whether we're talking dental school, medical school, any of those things, the school itself is about 15 years behind the profession. Mm-hmm. And the profession in general is about 15 years behind the research. So really, you're looking at way old school teaching. Like if you talk to a dentist coming out of dental school today, they don't know anything that I'm telling you right now. You already know more than they do. So you need to be your own advocate. And if enough of you listening go to your dentist and say, you know what, I really am not okay with that fluoride, but hydroxyapatite is what I'm going to do. So if you have an alternative that's hydroxyapatite here in your office, great. Yes, thank you. If not, I'll just go and take care of this at home. If enough of you are asking for these things, they will have to sit up and go, why did 5 people this week alone ask me about hydroxyapatite? Okay, fine. Somebody go find one that we can have here in the office. And change will come from you all asking for something different and better. It won't come from inside the profession. It won't. It's too far behind.
I love that you're highlighting we're really 30 years behind. And that makes me think, if we go back to our grandmothers, or even I think Weston Price.
Yep.
What are some tidbits that you would say this is what they knew about health and dentition that we here currently, we're recording this in 2025. Anything else other than what we've already said that's hello, people, we need to remember these fundamentals?
So a couple of things that are so crucial. Dr. Weston Price was an amazing pioneer. And a lot of people in nutrition know about him, but they don't always know that he was a dentist.
Mm-hmm.
So he went and he studied indigenous societies around the world. So places that didn't have sugar, and maple syrup on their breakfast anymore, yet.
Yeah.
They hadn't been introduced to the standard American diet yet. So he went around and what he was looking for is what was their health, not just their mouth health, but their overall health, and what did they eat? And then he looked at all of his findings and said, what was a common thread here? Of all of the people that had the best health and overall mouth health, what were they eating? And how did it differ from what people in the United States at the time were eating, which was in the 1930s, 40s? So low, it's way worse today than it was then.
Yep.
What he found is that people in the places that had good, strong teeth, nice, wide smiles, plenty of room for their mouths, plenty of room for their wisdom teeth, plenty of good sleep, all that going on, good fertility levels, strong bones, they had 2 times the amount of water-soluble vitamins. So this is vitamin C, vitamin B, 10 times the amount of fat-soluble vitamins. That was his huge takeaway. And what are those fat-soluble vitamins? Vitamin D3, vitamin A and E. He knew those. The one he didn't know, he called it activator X. We have now called vitamin K2. Mm-hmm. So those are the things he found 10 times the amount of in people that had healthy bones, healthy teeth, healthy bodies, healthy everything. So where do we find these? Well, this is actually an interesting one because I'll always remember this woman. She is a teacher. She teaches all sorts of people how to become like holistic health practitioners and about nutrition. And she called me one day. She's a good friend of mine, called me, and I had never seen her as a patient. She said, my daughter's getting married. Can you clean my teeth? And I said, well, sure. Just come on in. We'll just get you into the hygiene, schedule, and they'll clean your teeth for the wedding. So my hygienist cleaned her teeth. And then she came to me and she said, you need to go do an exam. And I said, well, no. She's just here like a quick visit today just to get her teeth cleaned for the wedding. And she said, no, you need to do an exam. And I said, oh, I get it. Okay, I'll come and do an exam. So I walked in the room, sat down, started looking at her teeth. She had 15 cavities.
Wow.
She and I were both blown away. She's like, what is going on here? I said, that's my question. What is going on here? I said, you're not getting enough minerals, obviously. And she said, but I eat so many minerals. Like, you know what I eat. And I do. Like, I know what this woman eats. I said, well, they're not getting in for some reason. She's a vegan. And when you eat a vegan diet, you are not getting fat-soluble vitamins. So let me explain why this matters. What vitamin D does is it takes minerals from the circulation. So let's say you eat a huge mineral-rich meal, okay? It's got a whole bunch of fruit and, you've got berries on a salad and some pumpkin seeds in there and all these things. It's just this delicious meal full of vitamins, full of minerals. You eat it, but you have no vitamin D3 because you've not eaten any source of it, either from a supplement or from a food. The vitamin D3 grabs the mineral, first of all. So that mineral just keeps circulating and it goes and it turns into tartar on your teeth. It goes and turns into stones in your kidneys or your gallbladder if you don't have the vitamin D3. Does that make sense? It's just going to keep floating around. So vitamin D3 grabs it. Vitamin K2 puts it into the cells where you need it. So you can have all the minerals and vitamins in the whole world, but if you do not have vitamin D3 and vitamin K2, those minerals cannot be utilized by your body. So that's exactly what was happening in her case. That was number 1 offense. Number 2 offense was she was drinking distilled water. Distilled water has had all of the minerals removed. And basically the idea is purity. You want really pure water. But distilled water, reverse osmosis water fits in this category as well. It's what's called hungry water. It needs minerals to keep it balanced. Yeah. So what does it do? It goes and finds minerals in you and pulls minerals out of your teeth and your bones in order just to balance itself in the body. Mm-hmm. So if you're drinking distilled or reverse osmosis water, you must add minerals back. So she had a double whammy. She wasn't actually getting the minerals. Well, she wasn't getting the minerals because she didn't have any fat-soluble, vitamins from any sort of animal products. And she was actually having her water still all her minerals that she was getting. Yeah. So she had a double whammy, ended up with all these cavities. I said, if you've got all these holes in your teeth, you've got all these holes in your bones too. So she started adding a supplement of vitamin D3, K2. She wasn't going to change your diet, and I'm not telling you have to. You just have to get it somewhere. And then she started adding minerals to all of her water. And I don't think she's had a cavity since. So these things are so crucial. Just these little weeks that we go, oh, reverse osmosis water is so great. Everybody, let's drink all of this. But nobody says, wait a minute. You're going to get cavities because it steals your minerals. No. Just add some mineral drops back. Does that make sense? So sometimes, all these one-size-fits-all health recommendations, they sound all well and good, but we aren't considering how they're acting on the rest of the body.
Yes. I mean, absolutely. I love it. And the power of quality fat, the power of animal products, or if those vegans or vegetarians out there, we've got to find other alternatives. I mean, I remember when I lived on the big island of Hawaii on the Hilo side, it was all catchment water. There wasn't plumbing. So we would have to go get the double osmosis water. And so remineralizing. And I have friends who their babies just, bam, cavities over the top, and using quality omegas and quality fats. I think the 80s no fat craze really hurt our society in a big way. This is so good. Okay. Can we talk about autoimmune conditions? Things like Lyme's disease, things like Hashimoto's. Do you see any link, especially with autoimmune conditions? There's so many of them these days. And everyone that we know has been diagnosed with fibromyalgia, celiacs, whatever it may be. Do you have any thoughts on ties to dental health and autoimmune conditions?
Huge. This is why a lot of times patients we see are people who have these autoimmune conditions, have chronic disease, have been everywhere, and they're just not able to move the needle. And the doctor finally says, maybe you ought to go see the dentist. They come to see us and we literally turn everything around. Why? Well, when we look at autoimmune disease and even something like Lyme that may be a chronic, it's always going to stay in the body, or Epstein-Barr, or, some of these things, they're never actually going to leave you. But your body is amazing. Like, your body has this immune system that's capable of keeping you well. What you have to do is provide it what it needs to be able to do its job. That's really, again, that's the whole foundation of my new book is, what do your cells need? Well, they need you to provide them with what they need to do the job, because they know how to do their job. Your immune system knows how to keep you well. It knows how to stop cancer. It knows how to do all of these things. You need to give it the ability to do that. And here's where dentistry comes in. So there's 3 biggies. First, we've already touched on briefly, which is metals can interfere with the body's ability to function correctly. The second one is hidden infections. That's a huge one. The third one is oxygen from air, but let's focus in on that hidden infection area. So there's 2 main sources of that. Number 1 is root canals. So no matter how well the root canal was done, it is not completely capable of getting cleaned all the way. There's these little tiny feeder channels that go off of the main canal. They're too small to clean. They're too small to fill. So you always end up with dead tissue. And if you have dead tissue in the body, it's going to attract bacteria no matter what. So you have this area in the body, this dead tooth, that is a slow growing chronic inflammatory burden on the body. So the immune system is 24/7 distracted. It's having to take care of this tooth. It's having to try to tamp down these bacteria that are growing and do all the rest of these things. You get that going long enough, your body's immune system gets tired. It gets distracted. It gets incapable of taking care of you the way that it is programmed, that it knows how to do. So these infected root canals are often the difference between you being healthy and you being not healthy. How do you find them? You have to get a cone beam CT scan. I'll always remember a lady, she had this root canal and she was always, just like telling me, I don't know, it just doesn't feel right. And that's what people usually say. They don't say it hurts, it just doesn't feel right. I took a regular dental x-ray. It looked fine. I said, you're just fine. But I had just gotten this new cone beam CT scan. And I said, you know what, let's go get a scan. I got a scan and could not believe it. There was a quarter-size hole eaten away in her jawbone above the end of the root canal. I couldn't see it. I could not see it on that dental x-ray. So we have to get the cone beam CT scan to see, is that root canal truly, is your body capable of keeping it well still? Or has it invaded the jawbone? Is all that infection spreading everywhere every time you chew? So that's number 1 source. The second source is where you had teeth removed. And that's usually wisdom teeth. A lot of times those don't heal properly. It leaves a dead zone in that jawbone, which leads to inflammation again. Inflammation distracts the immune system. The immune system can't take care of you the way it knows how to do, and you end up ill. So I could tell you story after story after story of people that got infected root canal teeth removed or wisdom teeth areas cleaned back out again and disinfected and symptoms went completely away. Adrenal symptoms, issues with energy, even things like cancer and autoimmune conditions and cholesterol dropping over and over and over again.
Okay. So this is a personal note. Some of you know this because I had done a podcast episode on this. So I had an old root canal from 2000. Okay. It had a wisdom tooth on it. No, sorry. It had a crown on it. And for a few years, it just didn't feel comfortable. I would bite down. I was clenching back and forth, back and forth. Finally, they went in and I will never forget the smell. So this is 25 years. It was putrid.
Yep.
And I remember I think he was an orthodontist. Is that right? Probably. This is not an endodontist.
Yeah.
And he was like, that might smell like putrid to you, but it's victory for me because I think we've found the source. And ended up having to have the tooth removed. In the midst of it, I did take a round of antibiotics. It's the only round of antibiotics I have taken in 24 years. And I'm still recovering. The odd thing for me is I didn't really have any other symptoms other than just, it doesn't feel good. It just doesn't feel right. And so I'm curious for those that are listening that have had the root canal, they're saying something's not right. Maybe their CRP is elevated. Maybe they're struggling with brain fog. Maybe they are tired. Maybe they've tried all the things. They've been diagnosed with an autoimmune condition. Once the root canal has been done, whether or not they have a crown on there or the tooth is removed, then what? I also have had my wisdom teeth removed. I was just told in high school, everybody gets them removed. So all four were taken out.
Yep.
Yeah. So now in my scenario, what do I do now?
So now the tooth's gone, right?
Tooth's gone.
Yep. So even back up before then, does every root canal need to be removed? Well, my answer is no, if you're healthy and well. But if you're not healthy and well, then you are really taxing your immune system. And I have yet to find someone who has or had cancer that does not have an infected tooth or infected area in the jaw.
Fascinating. Wow.
Yet to find one. So it just doesn't happen. So if you're healthy and well, you're 14 years old, you got a root canal in your head, we're able to keep close eye on it, and you're waiting to get an implant until you're old enough. Great. I'm not a purist in that. There's some dentists who say absolutely not, never, ever, ever, and every root canal has to come out. I'm not that person. I'm a realist. I know that it's not possible for everybody. But if you're not well, if you have chronic disease, if you have symptoms you can't get to the bottom of, I would absolutely get that tooth removed. And then what do you do after it? So we replace it with a ceramic dental implant. So another name you might have heard is zirconia. So zirconia or ceramic, it's all ceramic top to bottom. There's no metal in it at all. So we're not introducing another potential issue. It's all ceramic top to bottom, and it replaces the tooth completely. So the dental implant is the root replacement, and then we put a crown on top of it. We have a connector piece, and then the crown on top of it, and it could be zirconia or ceramic all the way top to bottom. That's what I recommend for anybody who's getting a tooth out that wants to have it replaced. I mean, sometimes it's the very back tooth, and people are like, you know what, I'm completely fine without it. Great, then leave it out.
Mine is the very back bottom. So it's not an issue of aesthetics, but he was saying that the top tooth will continue to drop. So I've got to get it done, and it will change my entire bite. Okay.
Yep. So let's start zirconia. Not everybody does it. Not every surgeon does it. But make sure that you are ensuring that. I want a zirconia implant. That's what I want.
Okay. Thank you. Appreciate it.
Yep.
Okay. Last two questions. This has been so good. As I'm listening, I'm thinking, oh my gosh, how is the podcast team going to edit this out? Every single question has been so dense. I imagine everyone is listening is just loving this up. Okay. Top books. For those that are listening, what would you say are, say, top 4, top 3? What are top books that you say everybody needs to listen? And you're welcome to suggest your own. But what do you suggest as top books for individuals that are really wanting to learn more?
Yeah. You know what? I am going to suggest my own simply because there's a reason I wrote it. It really started with the way I got well, because I talk a lot about how I got sick, but I don't often talk about how I got well and the confusion and overwhelm that came with that, because that is where we all live when we're not well. We're completely bombarded by information, and every source of information is good, right? I mean, we can listen to so many podcasts and read so many books and talk to so many people and look at so many websites, and it's all good information, but you cannot move forward if you're confused, and that overwhelm leads to confusion. So that's where I was. And I started studying all these different methodologies and different medicine types, traditional medicine types, clear back 100, 200, our grandma's kind of stuff. I started studying it all, and I said, this has got to be simpler than this. So I took all of that information and I created an assessment that you take and you plug your symptoms into. So Oftentimes we think the symptom is the problem, but the symptom is simply your cells telling you what's wrong. So we just need to know how to interpret what they're telling us. So that's what this assessment does. You plug your symptoms in and it tells you this is where you start. Your liver and gallbladder need help first, and this is what you're going to give to them. So really, it is the way to cut through that overwhelm and to find this is where I start and this is what I do. And I could do this today in my kitchen. So that's why I recommend my book, is simply to get through that overwhelm piece, because that's where I lived for years. And this is my mission. I actually give all proceeds of this book to charity, because it's all my mission to help all of you live well. So my book for sure. There are a bazillion back here that I absolutely love. But one of my favorite books, actually, well, I'll tell you my favorite book of all time. It's called Animal Vegetable Miracle. It's by Barbara Kingsolver. You may recognize that name because she's actually a mystery writer. But she wrote this book, and it is her story about she and her family, how they lived within 100 miles. So they lived for a year only sourcing food within 100 miles of their home. It's absolutely fascinating. And the reason I love it so much is because she's an author. You know, she knows how to help you see things and feel it. And oh my gosh, I read it every year because I enjoy this book so much. But she gives you an insight into how you can really live this kind of way, even in today's world. How do you make it happen? No, it's my favorite book ever.
All right. And say it one more time.
Animal Vegetable Miracle by Barbara Kingsolver.
Beautiful. Okay. What about podcasts? So people are listening to this podcast. Maybe they've watched a little reel on your social media or my social media. Now they've gone in, they've listened to the whole podcast. So they're podcasters. What are some of your favorite podcasts? Where do you go to? Because we're so inundated by the barrage of information. It's hard to discern what is really valuable, worthwhile when our time is pulled in so many directions. So what are your favorites?
Yep. So I love Just Ingredients. If you've ever heard of Just Ingredients, she's fabulous. She has a line of products that is very low tox, low everything, all natural. So she's great. And she has some of the big name people on her podcast. So if you're interested in really hearing some real honest questions and some of these bigger names, she's the one to go to. I'm not a huge podcast listener. I'm a big reader. I love books. So books are my thing. But she's probably the one that I would go to first if you're really wanting to know these big kind of health influencers. What are they saying? And how do you filter it down to what do you do in your own home?
Yeah. Okay, great. Fun. Well, my goodness, what a substantial conversation. I'm curious if there's anything that for you feels left unsaid, anything you want to add from all of the twists and turns and directions that we've taken this conversation.
Just really don't underestimate the power that your mouth and your mouth health has on the rest of you. There is such an influence on how you feel, how you operate, how your cells are capable of keeping you well. And so much goes on in the mouth. So it is okay to say no to your practitioner. It is okay to find a new one that is more aligned with what you believe is right for your own body. You are your own health advocate. And if you don't feel right about it, then don't do it. Nobody can know it, but nobody should or could, can bully you into anything that you don't feel good about. So thank you for watching and, thank you for listening to this and learning enough to then be able to make some educated decisions, because that really is the key, is you saying, nope, this actually feels better to me and I'm going to look for this. So don't be afraid of that. It's okay to do it today. And there's enough of us now that you're going to be able to find somebody that will support your belief system, and you're okay. You're not crazy. You're okay. You're just doing what you believe is right for you.
Yeah. I often say you're not crazy. The world is. Thank you.
Right.
Thank you for being that pioneer. Once again, it's just like that one banging on the drum at the top of the mountaintops to help others find other options and to be reminded of the power of our oral health.
Yeah.
Does that mean we don't get to kiss anybody?
Nope. Just make sure that they're also brushing their teeth like they should and using soap alignments like they should.
And maybe we shouldn't be sharing toothbrushes in our house, but we do use good toothpaste.
There you go.
All right. Thank you so much for your time. Really do appreciate it. And like I said, everybody go to the show notes. You'll see all the links there. Buy our book, follow her on social. There's a lot more to come. And thank you for your time. I don't take it lightly. Cheers to all of us and cheers to our vibrancy.